Thank you for taking some time out of your very busy schedules and being with us here tonight. I'm quite sure we can make it worth your while by presenting some very informative ideas and new ways of treatments on the Ulthera technology. My name is Wolfgang Kramer. I'm the Director for Asia Pacific for Ulthera. I'm based in Singapore. It's a great pleasure for me to be here tonight and share with you and together with Dr. Duncan some of our clinical experience on Ulthera. Some of you may not have heard so much about Ulthera. Just in short, it is focused ultrasound technology that uses a single treatment to achieve tissue lift or tissue tightening. It's a brand new technology. Ultrasound, of course, itself is very established already, but the way it is focused into these different layers of the skin, this is certainly very unique. And without further ado, I would like to welcome Dr. Diane Duncan. Thank you so much for accepting our invitation to be here tonight. Dr. Duncan is a known and very respected presenter and teacher, speaking to colleagues at multiple international and domestic events each year about innovations in the cosmetic surgery arena. She is a graduate from Tulane University School of Medicine with residencies at the Texas Tech University Health Science Center and the University of Utah Medical Center. She has been in private practice in Colorado for over 20 years. Her interest in scientific research and its direct impact on optimizing clinical outcomes keeps her current with the latest advances and with our best to customize an approach that fits a patient's needs and desires. Good results look like it has always been the way. That's her motto. She's well versed in minimally invasive as well as surgical procedures. And she was also one of the first ones in the US to adopt the non-invasive new ultrasound technology called Ulthera. So without further ado, Dr. Duncan.
And thank you very much for waiting for us. We only had an hour delay. I hear that's not too bad. So I hope you enjoyed your dinner before we get started. One of my main interests is the skin-fat junction and how it can affect long-term appearance. My background in clinical research really started with injection lipolysis, and I don't know if you have any background in doing that. It's something that's not really so common anymore because we have new, better fat reduction skin contraction devices that minimize downtime and are equally cost effective. So one of the main reasons that I was interested in Ulthera is as a substitute for injection lipolysis to achieve both goals. So our current non-surgical skin tightening modalities are, I think, lacking in efficacy. The gold standard for plastic surgeons for many years has been dermal lipectomy, where we take out skin fat, such as a tummy tuck, brachioplasty type device, where your skin is tightened, you don't have an overlap or hangover. But the limitation of dermal lipectomies is that the skin you leave behind is really not any better quality. It's not improved, you still have some stretch marks, wrinkles, skin laxity. So many patients come back and really are wanting further improvement.
So what is the demand for non-surgical skin tightening? I think it's huge. And one of the ways I know this is that the Vaser people, about 5 years ago, did a market survey, and they found that 1 out of 100 people who had some localized fat and skin laxity would be interested in having surgery to repair that. 25 out of 100 would consider a non-surgical approach. So your market is quite a bit larger if you have non-surgical options. The ASAPS, the Aesthetic Society, tracks statistics every year to find out the number of procedures and the number of non-surgical versus surgical procedures. And of course, the non-surgical procedures are accelerating at a rate far above those with invasive surgery. So what is ultrasound? Ultrasound is basically sound waves at a level that people cannot hear. And the degree of power that you're getting from your ultrasound varies from device to device. If you have a jewelry cleaner, obviously that is not going to affect your skin or fat. And in order to affect skin, you have to get the temperature, basically it's a heat-mediated reaction. The temperature has to be at least 62 degrees within the dermis, and the Ulthera gets to about 70 degrees. And these are little focal parcels. It's a fractionated device, so you have intervening places where you don't have any damage and a little focal area of tightening. These skip areas make this basically a procedure that has no downtime, which is what we all want. We want instant gratification, look better, no downtime, no scars. So low frequency ultrasound, of course, is not going to be as permanently damaging. High frequency, you get a little bit more into the risky areas. So you can see that jewelry cleaners are fairly low. Physical therapy is a little bit higher. Liposonics, a little bit higher. Imaging, a little bit higher, but it has no therapeutic effect. So Ultherapy, 4 to 7 megahertz. The differences in therapeutic or aesthetic ultrasound, we have high frequency, but it's very controlled. Focused energy and sparing of the intervening tissue, I think, is the key for this particular modality. Unlike ultrashape or liposonics, which is a focused but it uses cavitation and creates a wide surface area of contiguous damage. This is fractionated and has a small area of focal damage. So target tissue, this is pretty superficial. Both liposonics and ultrashape are 1.5 centimeters. The depth of placement obviously is different, and the degree of damage is quite a bit different. So if you have really small micro-focus spots, you're not going to have a lot of problems as far as risk or therapeutic effect. The nice thing about the Ulthera is not only is it a therapeutic ultrasound, but it has a diagnostic modality as well. You have a screen of the treatment area that you're planning on treating, and you can tell where you are. The ultrasound will tell you if you're in the dermis, if you're at the dermal subcutaneous fat junction, or the brow area if you're close to the frontal bone. If you're close to the frontal bone, generally we tend to tell you to maybe take off the D-pad and use the superficial head instead. So the microfocused energy, you can see here's the ultrasound screen. The energy is being deposited in the subcutaneous layer here. That more opaque layer on top is the epidermis and dermis. These are the focal points of energy. Basically, a little deeper in the fat. And here is a visualization of the soft tissue layers. And you can see, if you look at this line right here, then this is the frontal bone right here. So you want to stay above the frontal bone. There's not going to be any brow lift if you hit the frontal bone. So you want to be more superficial than that. So coagulation with precision, I think, is the key. Now, one of the things that ultrashape and liposonics did is they figured out how to achieve a 1.5 centimeter precise depth of penetration of their beam and get just that level of fat. The problem with those two modalities is that if you have to go back and treat again at 1.5 centimeters because it's not adjustable, you're treating previous scar tissue. An ultrasound won't do anything for that. With the Ulthera, there's a variability in the depth of treatment. Currently, we have available depths of treatment are 3.0 millimeters and 4.5. Currently, we're working on a 1.5 millimeter depth, which should be available late fall, and a 6 millimeter depth for deeper subcutaneous tissue, which will be available sometime next year. So if you want to do multi-planar treatment, which I think is the key to success, you really want to think 3D in treating skin and subcutaneous fat and fascia fibromuscular layers. You need to be able to target the direct area with a precise beam that's going to get at the level that you need. And it needs to be variable. It can't be just one level.